Hey everybody. So we're going to continue on with our lecture in head injuries, and let's go ahead and get started here. Let me get myself out of the way. Okay, head injuries. Brain injuries from shear, tearing, and stretching nerve fibers is known as diffuse injuries or DAI. DAI interferes with the transmission of nerve impulses. Continuing on, as we get deeper into these types of injuries, we're looking at these brain types of injuries that actually caused from shear forces, tearing, even stretching of those nerves. This is almost referred to as a internal decapitation, which is something that possibly could happen. Is related to severe acceleration, deceleration forces. This could be auto accidents and stuff like that. Maybe mild concussion, moderate or severe concussion. Concussions themselves is a mild DAI. Presentation ranges from momentary confusion and brief complete loss of responsiveness, unable to usually results in a headache. Effects occur immediately and gradually improve. I'm sure you'd be surprised. I think a lot of people actually had concussions in the past and never even really understood what they did. Signs and symptoms of this: momentary confusion lasting several minutes, retrograde or anterograde amnesia, repeated questioning about what happened. I've seen this happen before. Irritability or resistance to treatment. Combativeness would be some signs and symptoms: inability to answer questions or follow commands. Nausea, vomiting happens with most any type of head injury, and restlessness could be something we look at. Bruising or swelling to the brain is part of the cause of what's happening here. Can accompany can accompany concussions, may or may not cause increased intracranial pressure. Bruising is bleeding internally. The more severe bruising would be more bleeding, which would consist of intracranial pressure. Mild bruising would probably lead to less of that. Caused by counter coup, or acceleration deceleration mechanism. And acceleration deceleration, think about it in that car accident we're talking about. As you're moving 100 miles an hour, you are just free flowing with that car, right? As that car comes to a boom, an abrupt stop, you are not connected to it, so you are accelerating forward and then quickly decelerating, come back to your space. Same thing happens in your head when you're moving, or you get hit hard enough. As your head moves, let's talk about that baseball hit in the forehead, right? As the head moves, the brain is not connected to the scalp and to the skull and everything else. It's free floating. So as you move, the brain stays. Now it smacks up against the side of your cranium and bounces back and forth. That's the counter coup injury, or acceleration deceleration. Contusion signs and symptoms include initial signs of concussion plus one or more of these: decrease in mental status, unresponsiveness, paralysis or unequal pupils, which tell us we have a brain issue happening. Could also see vomiting. Again, any head injury is going to lead to this. Altered vital signs, profound personality changes. This typically leads into more aggression, more anger, or even some skittishness or being afraid. Is unusual for that person. So this is where we kind of need bystanders, family, and friends who can look at this person and say, that doesn't make sense. It doesn't fit the category of this person. Subdural hematomas, collection of blood between the dura mater and arc mater, results from damage to bridging veins in the skull. And so we have that increased bleeding that's happening between the skull and the brain itself. The hematoma can lead to increased intracranial pressure. It's pushing on the brain. Here's your transverse sinus, your superior sagittal sinus itself. This is the hematoma, okay? And here's the dura mater, that space in between the skull cap, and the brain. So as you can see, as we get into bleed on the outside here, the dura mater pushes against the skull cap, can't go any further than the skull cap, so it starts to push the opposite direction. This is intracranial pressure. This is a hemorrhage, or it's a shifting of the brain tissue, which is not a good thing. Herniation of the brain tissue, that's what I was looking for. And in this respect, one of the best ways and simplest, easiest ways to actually relieve this pressure is boring a hole through the skull into this bleeding matter to allow the blood to come out. This is ICP, intracranial pressure, and tempering is the way we actually handle it. Not as an EMT, this is just something we have to identify. It's hospital staff, specialized doctors who take care of this kind of stuff. Subdural hematomas, acute signs and symptoms being begin immediately. Oculate signs and symptoms are delayed for several days or weeks, and the elderly, those with delayed blood clotting and alcoholism, are at increased risk of this. Alcoholism and blood clotting issues, these are things we do to thin blood. So we have blood clotting issues, warfarin. I can't think of the others right now. There's several others that we use to thin blood, and so that allows blood to flow smoother. Alcohol is the same thing. It actually thins your blood, allows blood to flow smoother, which means if we have bleeding subdurally inside, the bleed is going to happen fairly easier. It's going to have a tougher time stopping. Another one too, aspirin. Somebody who's on aspirin regimen for post-cardiac, they are going to have thinning of blood, so that we're going to have the same kind of issue happening here, concern happening here. Subdural hematoma signs and symptoms, weakness and paralysis on one side of the body. Deterioration in the level of responsiveness, their ability to communicate and focus with you. Vomiting, head injuries lead to this. Dilation of one pupil, unequal pupils is what we're seeing. And one is specifically is going to dilate. Abnormal respirations, apnea, which is lack of breathing or without breathing, increased systolic blood pressure, decrease in pulse rate, and headaches. Headaches can be pretty severe. Seizures with these pressures building inside, eventually seizures could happen. Confusion will happen. It's going to be pretty astute. You're going to see it pretty quickly. Personality changes. Definitely going to see some, again, going to see some people that aren't acting normal. And family is going to help us understand that, or bystanders help us understand that. Epidural hematoma, more rare, but extremely emergent, often associated with fractures to the temporal skull, which is going to be side of the head right here. Bleeding is rapid and severe, causing a rapid increase in intracranial pressure. We're going to see some more of this, bleeding from the ears and nose. And again, we don't want to stop these bleeds. We want to slow these bleeds. Here is your epidural hematoma down low, because that's the temporal, going to be on this side. Let me get myself out of the way. Excuse me. Sorry, guys. So temporal bones down here, and we get more bleeding quicker up in here. And if you guys notice carefully, we're getting close to that basal skull down here, which is a very thin floor of the skull itself. Epidural hematoma, signs and symptoms, increased systolic blood pressures with decreased heart rate, Cushing's reflex. I'm going to ask you guys to look this up. We're going to talk about it when we get a chance. This is something we want to discuss a little further, but I want to talk with you guys specifically about it. Vomiting, apnea, so without breathing, abnormal breathing patterns, posturing. When we talk about abnormal breathing patterns, what we're actually discussing here is it's referred to as agonal respirations. And agonal respirations can be defined as the last breaths before death, or the death rattles, another reference to it. So even though we have breathing, make sure you understand it's very ineffective, and we need to manage it ourselves as best we can. Posturing is something I'm going to make sure you guys have a video of. This is we're going to talk decortic and tecerebrate posturing, where we actually have turning out of the hands, turning out of the feet, or drawing in of the feet, drawing in of the hands during what almost looks like seizure motion. I think we watched this video once before. I'm going to post it up again, though, because it's important we understand. Lacerations may occur with closed or open head injuries, resulting in bleeding, nerve system disruption. And so, those lacerations, again, are going to lead to bleeding. It's okay. We want this bleed to actually come out. It can be internal, open or closed. That closed injury does not break the skull, but we do have to be aware of the fact that it may be bleeding underneath still, which is creating that intracranial pressure. So that takes care of that, guys. That's all I really needed to do with you today. There should be a third video. Well, there's going to be a third video coming up, and if I need to, I'll post a fourth. We have taken care of getting people trying to sign up for Google Classroom. Attendance is being handled on my end, and we're getting ready for finals. So I want to make sure you guys are preparing and studying, getting ready for that finals. I will be putting out a study guide for you very shortly. And like I said, just recently with Tuesday meeting, and I'll mention on Thursday that I'll be creating that test here real shortly. So we have that full 150 question test final will be coming up. Okay. Thank you very much. You guys take it easy. Bye.